and but that they would be able to get some opioid education. And so one of the focuses is really reducing the stigma of opioid use disorder. It can be pretty brutal. I've learned not to read the Facebook comments anymore when discussing, situations of providing outreach and that type of thing. So really trying to destigmatize this disorder, and teach and educate the community what this really looks like and what people are experiencing. Go ahead, Joe. So before we get started, I just wanted to include what the difference between opiates and opioids are. The reason is because I often use the words interchangeably, and sometimes people can just not know the difference. And it's not a huge difference, other than the opiates are drugs that come specifically from the opium poppy plant. Opioids are either partially or fully synthetically made in a lab. So if we're talking about opiates, we're talking about codeine, morphine, heroin, or opium, and that is specifically from the opium or the poppy plant. When people refer to opioids, they're talking about medications that are partially or fully made in a lab. So methadone, Percocet, oxycodone, fentanyl, buprenorphine, all of those on that list are the difference. So a lot of times people use them interchangeably and they have the same effect. This is just a little of the history of what the difference is. The reason I enter information about not opioids, what opioids are not, which are methamphetamine, cocaine, benzodiazepines, Valium, spice, ecstasy. This is included in part of the Narcan training because Narcan, which we are going to talk about, does not reverse an overdose for something that is not an opiate or an opioid. So if someone's experiencing an overdose on methamphetamine, one, it's going to look a lot different than an opioid overdose. But two, if you were to give Narcan to someone to try to reverse that overdose, it would not work. Go ahead, Joe. So who uses opiates? This is a big part of the training that I do is letting people know it's not just people who we see experiencing homelessness on the streets and expecting that they are just using drugs. People with a substance use disorder absolutely struggle with opiates or opioids. In addition, a person that's had a surgery, or if they have a chronic pain or chronic medical condition, dental issues, these are all people that are using opiates or opioids. And the question is, who can overdose? Anyone that is using an opiate or opioid can be at risk for a potential overdose. Talking about family members and friends, if they're using a prescription that is not theirs, that's a potential for an overdose, because we're given prescriptions based on the medications that we're using, our body type, our medical, we work with our doctors when we're given a prescription. So if someone takes a medication that is not prescribed to them, there is a chance that an overdose could occur. We're seeing that overdoses occur in kids when they think that medication looks like candy, or they don't know what it is. So that's an opportunity that kids could potentially overdose. This is one of my, I personally relate to this because I've been taking vitamin D since COVID started. I've heard that that's supposed to be helpful. And every morning, I take my vitamin D, but sometimes, it'll be the afternoon and did I take my vitamin D this morning? I can't remember. So if I think of someone who's, prescribed multiple medications and unable to remember if they've taken that medication yet, there's a chance that they could take the medication, too much of it, and then an overdose could occur. That's also if someone's experiencing more pain. So there's the thought, well, I'm going to take an extra opioid right now, even though it's 2 hours early, and I'll try to stretch it out. All of these things are valid, rational thoughts that people, think that it's going to be okay. And they're also at risk for an overdose when some of these things happen. A lot of times people that I'm working with are someone who hasn't used an opiate for a few days and then they resume use. So if they've got detox because they want to stop using, if they've just gotten out of jail, or they've just tried to quit on their own, and then they go back to using their body has lost that tolerance buildup, and there is a chance that they would overdose at that point. And then also someone who uses an opiate with another depressant, such as alcohol or a benzodiazepine, um, that can be extremely dangerous, just because they're both depressants, and then it can cause the person to not be able to breathe. Okay. So what is Narcan or naloxone? Narcan is the brand name for naloxone. It is a prescription medication that can block or reverse the effects of an opioid overdose. So anyone can easily use naloxone to save someone's life. And this is, like I said earlier, this medication will only work for an opioid overdose. Go ahead. So this is the most recent graph that I was able to find, but this is nationally, these are overdose deaths involving all opioids. So you can see that this pandemic that we're experiencing with COVID, well, we'll get to that in a minute. Sorry, got a little ahead of myself, but the opioid epidemic is not getting better, unfortunately. And fortunately, due to isolation and less connection that people in recovery have been experiencing during the pandemic, overdose deaths have gone up. So it's really important that we're still aware that this is occurring in our communities, so that we can be available to assist. So the next slide, this is just specifically heroin. So you can see 2011 is when the oxycodone, the Oxy 80 pills were changed. The formulation was changed at the end of 2010. So in 2011, you can see the opioid use has gone up, specifically with heroin. At that point, a lot of people were not able to get the same high. Their prescription medications had been cut off or changed. So someone could buy an Oxycontin 80 pill for $80 on the street, or they could buy $20 worth of heroin and achieve the same effect. So that was when the heroin epidemic and that specific drug really took off. Go ahead. Now on the streets, we're seeing a lot of fentanyl, which is extremely dangerous. It's the most powerful synthetic opioid. Well, carfentanil is the most, but it's extremely powerful. It's 50 to 100 times more potent than heroin. You can see on this slide the looks like sugar grains, but it's the heroin in the glass vial, and then the fentanyl. Just those few grains are similar to the amount of heroin. Carfentanil, I think there's just 2, maybe 3 grains in there. Those, that's a large animal, like elephant tranquilizer type medication. But I was looking on a report the other day that was saying that in 2019, there were 71 deaths from fentanyl. And this is just in Snohomish County. And then in 2020, we don't have all of the numbers yet, but they're pending with the number right now sitting at 114. So that's a huge, huge jump. I mean, I think it was 2016 was the first one. There were maybe like 10 or 12. I mean, it is continually gone up. I was actually in a camp right before I came here to do this, and met a kid that he told me he's, smoking the fentanyl pills that are those are the main thing out there right now that people are using. Do you want to go to the next slide, Joe? I can't remember. Yeah. So these are the pills that are on the street. The real pill on the right is like the Percocet 30 pills. People are making fake pills that contain fentanyl. And unfortunately, the way that they're doing it is I'm trying to think of the best way to describe it. It's very unpredictable because half the pill may contain a few granules of fentanyl, the other half may have none. I had a kid who overdosed on half of a pill that he shared with his friend, and his friend did not overdose. I mean, it was just, you just don't know how these pills are being made, and this is a huge problem on the streets right now. And I think that especially our younger generation is thinking, well, this, I'm not doing heroin, I'm not shooting up, I'm not, doing, these are just pills, it can't be that bad. Where in fact, they are deadly. And go to the next one.
Amy, what did you say the real pills actually are? Did you say they're hydrocodone?
Percocet 30s, yeah, or yeah. Because of what's been going on in the streets, I was lucky to work with, I think some of you know Amanda Frankie as a co-worker of mine, and Cleo Harris. We were given some funding to be able to produce some billboards around the community. And this is what we came up with. It's really important for people to know that there are fake pills out there, and sometimes people don't even realize they maybe have just recently been cut off from a medication, and someone says, oh, I know someone who has some, you could buy them from them. Where in reality, they're going to be getting fentanyl pills that are really difficult to tell the difference. The other billboard that we wanted to have out there is to really be mindful of the fact that this pandemic has just really obliterated, for a lack of better word, the recovery community, in part, not for everyone. It's just been experience that I've seen with people who have recently been coming out of treatment and not experiencing the connection and the support that they need, just because it's not available, and they can't go to treatment in person. If they're an outpatient, everything is on Zoom, and just that physical, like, human connection has been really, really difficult. So being aware of that, I think, is super important. So the next one. So if you're interested in getting Narcan just to carry, because anyone can carry Narcan, you do not need a prescription for this medication. Even though it is prescribed, you have to get it from the pharmacist. There is a standing order in our state that the Department of Health health officer has signed, so that we are able to walk in and say, I would like to purchase Narcan. There's a list on stopoverdose.org that provides a list of pharmacies in our county that you can purchase Narcan or naloxone. The pharmacist will provide a brief training. It's similar to maybe if, like, you're getting a new medication, and they'll go over how to use it. I am also starting to amp up trainings again, just in the community, to have it available for people. I'm hoping to do another one probably in May is what I'm thinking, but we advertise them on Eventbrite. So I do a full training at that point, which I could share with you, Joe. If anybody's interested, let you know when the next one is. Narcan is covered under Medicaid, which is great. I encourage all of my clients who are not in a space to make the decision that they're ready to make a change to go and purchase Narcan under their insurance. They can't administer it to themselves, but a lot of times if they're using with someone, there is opportunity for that. Most insurance companies will cover Narcan. It'll just be dependent on if you have a copay or a deductible, or kind of what you're looking at with that. If you wanted to pay cash for Narcan or naloxone, it is between $125 and $160 per box. That contains 2 doses. So it was April of 2018, I think, the Surgeon General, Dr. Adams, came out and said that he was going to issue his first public warning in 13 years. And that warning was that Americans should be carrying Narcan. And there is evidence showing that more people in the communities that have Narcan and carry it, there are less deaths. So either way, no matter kind of, I know this group is different, but, understands if, you think, well, why would I do this? you can't help someone if they're dead, and having the opportunity to get into treatment, to make a change, to get the support that maybe they're needing, it's absolutely worth it. You're on mute.
Amy, I just want to reiterate what you're saying. So I actually have been prescribed Narcan. I have it in my office just in case I ever need it. The component here is that Narcan isn't just for pulling people who are addicted to the substance out of an overdose, but it could be your mom and dad, right?
Absolutely.
Our elders are prescribed increasing amounts of painkillers. Who knows how those will interact with other substances they've been prescribed. And if you find them on the floor, heavy snoring, or whatever the case may be, you can administer Narcan without consequence if they're not overdosed.
No, that's a great point. And kind of thinking back to, how we were saying, if someone forgot that they took a medication, I mean, it's an easy thing. I've done multiple senior center trainings, where, I mean, it's a real thing. As we get older, our bodies don't work the same. Our liver doesn't process things the same way, and we could have a reaction to a medication. This is not just for people that are, struggling with opioid use disorder. This could be someone who takes by mistake a kid or anything. And I think it's so hard to not do a whole Narcan training while I'm doing this, but one thing I do want to mention is the other great thing about Narcan is that if you're unsure if someone's experiencing an overdose, you can give this medication, as Joe said, without consequence. So that meaning if you walk up and you don't know if someone's experiencing a heart attack or if they're experiencing an opioid overdose, and you take the chance and give them, you have Narcan and administer to that. If they are experiencing a heart attack, it's not going to hurt them. It's not going to help them in any way, but it will not hurt them to give them the Narcan. So it's great because it really takes that out of it, of being afraid to administer that something would go wrong.
And then I'll just add before you advance, I'm so sorry to interrupt the presentation. One of the challenges we have at the community level, at least in Monroe High School and other local schools, is kind of a resurgence of the use of medicines with codeine in them. And in a small percentage of the population, codeine can be metabolized just like morphine. And a small dose of cough medicine from Canada with codeine can lead to overdose, similar to a morphine or heroin overdose. And so this is another reason why Washington State has approved Narcan for use in schools. In fact, it goes beyond approval. We've been looking at policy this year from the Washington State School Directors Association model policy that basically directs us to start keeping a supply of Narcan on hand. So this is why this is directly relevant to this coalition, even beyond what we're seeing in the community. This is a requirement for school districts now to carry this. And Amy, last question, I'll let you keep going.
Yeah, you're good.
And I know what Narcan is, but how is Narcan administered?
Nasally. So actually, let me grab one in my...
So it's a nose spray.
It's a nose spray, yeah. So mine is in a little bit, it's not in here. I didn't use it. I did just give that kid that I met earlier today, we had some available that was from CHC that was really supportive of our trainings. So I gave him a packet of Narcan because he wasn't ready to make the move to the diversion center. So this is what the Narcan looks like. Can you see that? And then it's just a nose spray. So you just peel it out and then it's got a plunger. And then you just put it in the nasal passage and then shoot it in the nose. So it's very easy to use for sure.
I have a question. Is there a life on the Narcan?
Is there a what? I'm sorry.
A shelf life? Does it expire?
Great question. There is the best news that I received in September is that the FDA extended the shelf life. So it was about 1.5 to 2 years typically. Now they've extended it to 3 years. So this medication, it says that it's expired in May 2020. I would have opened it and showed you how to use it, but now I get to extend this. So it'll be good through May 2021. The new Narcan that they are putting out has a red plunger that has the new expiration date. So I keep and I encourage people to keep extra Narcan if it's expired. Before they did the extension, we'd had a few saves that had been reported to us that was with expired Narcan. So it was, I'm glad that they updated that because it's expensive. It's an expensive medication and it was still working. So yeah, good question. Thanks, Kathy. So talking about resources in Snohomish County, the Carnegie Resource Center is right next to the jail. It's kind of in between the Diversion Center and Snohomish County Jail. With COVID, these have been a little hit and miss because they're not easily accessible as they were pre-COVID. But the Carnegie Resource Center is a place that people can go. It's kind of a hub for looking for DSHS, getting assessments, mental health, employment information. It's been a great resource. The Diversion Center is something that our social workers work directly with. So if someone is homeless and they decide they're ready to make a change right at that moment, we can pick them up and take them to the diversion center. It's a safe place for them to be. Usually it's about 10 to 14 days that it takes for us to get them there, get them set up on their medication assisted treatment if that's the route that they're going to go, get an assessment, get a bed date, and then go through that process. Any medical appointments that they need to go through, we support them through that. And that's the numbers have been cut back because of COVID, but it's still a fabulous resource. It's run by Pioneer Human Services. And it's nice because if we're working with someone who's experiencing homelessness and they don't have a cell phone, if we have a bed date that was, comes available for them and we can't find them, then we lose the bed date. So this was a great, this has been honestly, it's been a game changer for our team to be able to keep everybody together and give them support while we're going through that process. The opioid outreach specialist, my role is similar to the embedded social workers, sit down with people who are experiencing opioid use disorder, figure out what the plan is. There's so many different paths to recovery. And I think looking at what each individual is trying to, what they're trying to strive for and with what they know and think will work for them. This is not a cookie cutter approach for people in treatment. Everybody has a different path. So just looking to support them in any way that we can. That goes along with our embedded social workers. We have one in Monroe, Elisa, who's a colleague of mine. She's with Monroe and Snohomish County. Gannett, Heather are both with Snohomish County. And then we have Arlington and Marysville with Brittany and Rochelle. So Linwood PD just hired an embedded social worker. So we've got people that are side by side with law enforcement instead of taking people to jail, working with them to do something different. And then of course, treatment agencies that we have around our county and medication assisted treatment, which is proving to be exceptional for people struggling with opioid use disorder. And it's been a really positive outcome for them.
Amy.
Yes.
Isn't medication assisted treatment just moving people from one drug to another?
Oh, you seem like you're a plant in the audience. I'm kidding. That comes up a lot, Joe. And with that being said, yes, there is a medication that you're moving to. However, if you are stable on Suboxone or Subutex and moving forward in a positive way with treatment and support, you're probably not going to be going to steal and rob and burglarize people to get your street drugs, right? You're not going to be using heroin or, needing to get your fix because you're going to be under a doctor's supervision. So the craving is diminished from clients that I've worked with that have said that that has been a game changer for them, where yes, they're on a medication and they are getting through life in a really positive, successful way. All right, next one. Oh, that's it. Yeah. So any questions that I can answer for you, I'm happy to. Chris, do you have a question?
Yeah, I have a question. And is there data being kept on where we are in terms of the number of people who are prescribed the really high levels of opiate prescriptions that are legal prescriptions from doctors? And also remind me, is there a limitation now on what doctors can prescribe? They can't do multiple refills and all that kind of stuff.
Right. Those are good questions. There is a program that I think it's PMP. Juliet actually may know this.
The PDMP, prescription drug monitoring program.
Yes, thank you. So that they can see, that was put in place so that people couldn't go from one doctor to another and say, that they need
Right.
all of that. Yes. So in Washington State, it's funny. Now that, we're all virtual, I attended a Narcan training that took place in Erie County in Buffalo, New York. It's right before my training a couple of weeks ago. And I thought, I'm going to see what people in other parts of the country are doing. And they have something similar. It's not called the same thing as it is in Washington State, but it was just really interesting to know that these different states are coming up with these, protocols so that medications aren't just being used and spread out. And I think I don't have an answer for you on, what the doctors specifically are, required or allowed to do, but I can tell you that it seems as though it's been pretty individualized from each doctor. My son had his wisdom teeth out last summer. They did not give a prescription for opioids. And then my daughter just had hers out a couple months ago, and they did give a prescription if you wanted to fill it. And there was also quite a bit, I didn't say what my job title was. I just took it and left. But it's really interesting. I think it just depends on who you're seeing and kind of what their thoughts are.
Thank you.
Yeah.
Is physical pain a primary starter of getting people involved with the opioids, or is that just one of the roads? Or it probably is just one of the roads, but
it's a good question. I think it's probably a big wide road.
yeah.
Most of the people that I've worked with, especially younger people, have experienced some sort of medical situation, an injury, wisdom teeth, something like that, and then have really enjoyed the feeling, especially if they'd had some traumatic experiences and had been struggling. Then it was, they really liked how that felt and then continued down that road. Or if they're in a situation where the pills are available at home, a lot of times that's where it will start too, is like, oh, what are these? I had a mom tell me that her son had taken the stepfather's heart medication. He didn't know if it was going to do anything, but he wanted to get high. So he had stolen the heart medication to see if it would do anything to make him feel better. So just having them available, which is, that's part of the other training too, is really understanding that getting rid of unused medications is so important.
I have a question for you.
Yeah.
What is the recovery and areas of, where you guys are doing treatment or prevention? What are the thoughts behind all of the different changes in laws that we're getting in Washington with regards to what's been going down of what you can get arrested for or not arrested for with regards to drug possession?
Is that an Amy question or a county question?
I don't know. I'm just really curious because when I hear it,
I think
of
of
Joe at the coalition and think can this potentially be a good thing at all? Because I don't see how it could be. So
Um,
when you're saying,
just want to
when you're saying
remind
all
you,
the issues.
yeah.
sorry,
What was that?
Amy, want to remind you, we're recording this, so you are a representative of the county.
Yes, I am. Thank you. Good reminder. And luckily I only have a couple minutes, so you can't go on for too long about it. I think it's a really good question. I think there's a lot of things that need to be ironed out in how we move forward and kind of explore this. I was at Dutch Brothers earlier with 2 deputies, and a gentleman came up and said, "There's a man smoking off of foil around the corner in his car. Can you go do something about it?" And we weren't able to. That's hard for me because from my point of view, I want to be able to provide outreach. If there's something, you know, that we could do. I also think that it's a positive thing. Not just throwing.
Someone- Hello, someone's dog is barking and
Is something happening? Tom, is that you?
Back. I don't think
Joe, will you mute yourself?
Is that good? Better? Okay. I think that there's a lot of situations where people are put into jail for maybe a day or 2 for a charge, and then they get released, and then it's just this cycle that keeps happening. So trying to figure out what that's going to look like, how can we intervene or stop or provide support? There's so many pieces to that question. I wish I had a good answer for you. I think that I'm hoping that we can make it a positive change. For the example that I gave you earlier today, that was really difficult. You know, so I know it's not really an answer, but best I can do.
Thanks for trying.
Yes.
Julia, anything to add to that?
I don't think I have any good insight at this point.
So the only piece that I'd add is there is companion. So the Supreme Court just, the state Supreme Court just ruled that we cannot essentially bust for possession. It's more detailed than that. But there's a companion bill, coincidentally, that's going through the Senate right now that actually would authorize law enforcement to intervene, but not to arrest. So this is Amy's opening to do that outreach instead of having to walk away.
Which
So
I think
like-
is huge. Yeah.
Yep.
Because
So like
going to
Amy-
jail for a night or 2 is there, it doesn't break the cycle long enough to try to do something different. This is just from the experience that I've seen with people that I have worked with. So that's the only thing I'm speaking from, is that's just, if there's a longer period of time, then there's some kind of, you know, working together. But it's just, yeah.
And from, I think, a taxpayer stewardship perspective, if these are nonviolent offenders who are deferred from jail into treatment, it saves the community a lot of money.
Yes.
I mean, in my community, as a member of my city council, I see the cost we incur whenever we incarcerate anybody. And what you may not know too is when a city incarcerates one of its residents, they're responsible for every cost, including medical costs. This is a huge impact to our tax dollars. So there are pros and cons, I think, from an economic
Definitely.
argument and a human help argument.
Absolutely. And I also think it's a really good opportunity for us to grow from it, you know, and figure out what it is that we are going to be able to provide instead of just feeling like, oh, I can't do anything, or, you know, it's going to be okay. Well, it's not working this way. So let's find a new way and make it better. So that's kind of my hope. And I hate to do this, but I do have to get going. So if there's any other questions, please feel free to reach out to me anytime. And I'll let you know, Joe, when we have the next Narcan training.
Perfect. Perfect. We want to promote that for you.
Thank you. Thank you all so much.
Well, I'm going to share my screen one more time just so we can see where we are. In terms of the agenda, we're almost wrapped up with everything. I want to do a couple of business updates for you so that you have an opportunity to be involved where you want to be. Now that we have school resuming for elementary school, our earliest grade teachers are already beginning to implement the PACS Good Behavior game. So this is great for us. Second step is being implemented virtually, kindergarten through 5th grade, and will continue to be implemented in person. Botman's Life Skills Training Program is implemented in 6th through 8th grade, and that is implemented that is being implemented right now. Sport Prevention Plus Wellness, which is a single session marijuana reduction program, has been suspended. How we've used this program is if a student is caught violating the substance use policy on campus, they're referred to receive a sport interventions, prevention plus wellness intervention. And with no secondary students really on campus, we haven't had those referrals to that program. We fully implemented signs of suicide with all students 6th through 12th grade this year. Our Sources of Strength group is not school-wide, but one of our student support advocates, Mr. Raylan Lucy, is doing a Sources of Strength small group work, primarily serving students of color. Coping and support training is our more intensive suicide prevention training. It's a 12-session, hour-long intervention that has incredible outcomes. But because it's 12 in-person sessions, we haven't been able to translate this to the virtual environment. So CAST is effectively suspended, although we did train an additional school counselor so that we can implement at Hidden River Middle School next year. Of course, we finished Screenagers. We had about 110 ticket sales. And if you multiply that by however many people in a household would have watched this, we won't know the true number, but I think we're on par with what we'd normally see in the theater with several hundred people at least. Parenting Wisely is an online parenting class, an evidence-based program, and that continues to be implemented, although very slow. What we're finding is that people are just exhausted by being online. And so until we can really resume in-person classes, I doubt we'll be very effective in promoting that program. Project Success is being implemented by Chris Jury's successor, Stephanie Phillips at Monroe High School. She has about 30 students on her caseload. So this is being implemented as well, just in smaller capacity than when we're in person. And then Teens Are Under the Influence of You, our social marketing campaign, has started running again at the Galaxy Theater. The Galaxy Theater is still at only 25% capacity, so our videos are running for free at least through March and maybe through April. We're also advertising now we're promoting these videos on Spotify. And so Spotify is proving to be a very cost-effective way to reach people and confirm that they're seeing our message. So I think we've reached 1,000 people directly. I mean, the app has confirmed that, and it's cost us like $7. So super, super cheap, super cheap. So pretty excited about that. The other piece of business I wanted to inform you about is Washington State Healthcare Authority, our primary funder, just opened up their suicide prevention and mental health promotion request for application process, the RFA process. And this is what we use to fund programs like Signs of Suicide, Sources of Strength, CAST, and Youth Mental Health First Aid training. There have been some pretty significant changes this year that really make sense. In the past, we've only been able to apply for suicide prevention or mental health promotion programming, even though mental health and suicide are directly related. They've been separated in the past. Now we can apply for suicide prevention and mental health promotion on the same application. The other thing that's changed is the total possible funding amount we can request has jumped from $20,000 to $65,000. And then Healthcare Authority has also released a second request for application using dedicated marijuana account funding And that has jumped from a total possible award of $20,000 to $65,000. The other thing that's changed is now you can apply both for dedicated marijuana account funding and mental health promotion and suicide prevention funding. And so if a community is awarded both at maximum funding rate, that's $130,000 a year of additional funding. Now, this is something I'm going to be reaching out to the leadership team to help me consider here next week, because that turnaround time is extremely short. Even though the RFA was just released, it is due with all of your partner signatures and your implementation plan by March 26th. So HCA continues their tradition of giving us no time to pull together meaningful planning efforts. But we're ready. We're always ready. And then the other larger issue is most of the programs that are being funded are direct service in-person programs. And so even though we have this large funding award available to us, I'm not quite sure we would want to request that amount, because I don't think that we're going to be in a place, at least at the beginning of next year, to offer those in-person services. So as you're hearing about the conversation in the community of whether or not schools are going to be fully open next year, it really comes down to one number, and that is the number 6. 6 is the social distancing footage that we need between students, and conversation happening at Department of Health and with health districts is whether or not in schools that social distancing number can be shrunken down to 3 feet. If that's the case, school will fully reopen, because that's about our norm anyway for distance between students. If it remains at 6 feet, we simply don't have the capacity, the square footage capacity to accommodate everybody. And we certainly don't have the bus capacity to return all schools to in-person learning. So that number 6 is really going to determine our future, and that's what I'm monitoring. So that said, what I'll be approaching the leadership team with is really the question, what should we do? What can we do? And then regular participant on our coalition meetings is Lindsay Gagnon, who is the Volunteers of America Western Washington Regional Director for Snohomish County. And Lindsay reached out to me yesterday about a possible partnership with Monroe Community Coalition. And there are several benefits of that that I'll be presenting to the leadership team before we get back to you. That is simply that Washington State Healthcare Authority is giving preference to communities designated as high risk. In Snohomish County, there are 2 high-risk designated communities, and that is Granite Falls. So Dennis, glad you're on this call, and the community of Sultan. If Granite Falls and Sultan apply, they'll be awarded special points in the total scoring of the application because they're from a high-risk community. The other communities that get special points are those that are associated with the CPWI initiative, so us. So if you're associated with a healthcare authority funded coalition, you will get bonus points. So with the total funding award being so high, it may be a slam dunk guarantee that we're going to get funded if we partner with a high risk community. But we just have to have a conversation around what that would look like. And if we have a way to apply for the maximum award and that can benefit our students, then that might eliminate that partnership, because we want to serve Monroe first. So that's the update. New money available, no time to apply for it, but we're going to anyway. And I need to pull the leadership team together to help make some decisions about what we're going to be doing. The other thing that we'll be doing next month in terms of coalition business is it's really time to evaluate what our plan is for next year. Because we don't have healthy use survey data available, Healthcare Authority does not want us to rewrite our strategic plan. So that's a short-term blessing, because that's a huge body of work and it's always due on June 15th. And this year is a complete rewrite year for us, not an update. healthy use survey will be implemented this coming fall. And so next year will be a full rewrite of our strategic plan. So we just need to have some conversations about which of the programs on this page we want to continue, which ones we can continue if we're not in person, and what we want next year to look like, both in terms of our evidence-based programs and our community-based strategies. So that's all on the horizon, but not today. Otherwise, I really just wanted to turn this over to you. You guys have had to digest a lot of information. It's only fair if you turn the tables and make us digest your information. What I'm wondering is if we can have Chris Gray go first, since she has something to share. You're on mute.
Can you hear me? All right. We have begun a process. I'm with Housing Hope. We've begun a process in Snohomish County where we would like to partner with some school districts. We began one in Everett, but we didn't have really good luck with that one because of some blowback by the community. But what we would like to do is work with school districts that may have surplus land that they would either give us, sell to us cheaply, or rent to us. And then we would take it upon ourselves to build and service homeless children in the school district and their families. So we're working right now with Everett. We're working with Edmonds and Linwood, and we have had an initial meeting virtually with Dr. Blasco of Monroe School District, and he was very interested. So they'll be looking at what they have in the area of surplus land that they would be willing to partner with us in terms of getting some additional housing for homeless students and their families. So good news. Now you're on mute.
Of course, it's COVID, and I still haven't learned how to unmute myself after a year.
Yeah, yeah.
Is there anything we can do to help support you?
I don't think so at this point. I didn't get any sense when we met with Justin that he had any qualms about it. I mean, he'll be looking at, you know, what properties available and what would fit into that category. We do have a need to have it pretty centralized because we would like to have access to services and to transportation and things like that. So something out in the hinterlands of the district is not something that would really work very well. But I think there's a piece of property I have my eyes on that would work really well.
I'm on that committee also with Chris, and so I can keep our board up to date on, or the community coalition up to date on what we're doing on that. So
exactly,
Wonderful.
I'm very optimistic that we're going to be able to work with Monroe School District to make this happen.
and I switched over to my phone from my
We can see you now.
computer.
Yes.
So I have been here listening, but
So I don't know, Tom, if you have something to add to that.
no, I thought
You
the
were
same
on,
thing.
he
I
was
thought-
on the virtual Zoom
Yeah,
call too.
I thought the same thing. I thought that the key piece was getting Justin's support, and he jumped right on it, and it made sense to him. And yeah, so it went well. And we asked, who do you want to be to get back to you? Do you want one of us to? And he said no, he would work directly with the head of Housing Hope. So I mean, that was. It was,
Yeah, we had
it was
the
as
head
much as
honcho.
we could have asked for.
Wonderful.
Yeah, but it's a great idea, you know, that if you find a piece of property that is close to services and bus routes, and you can house and service those families that are living in their cars and stuff.
Yeah.
And
And it would save the district money with the McKinney-Vento and stuff like that with the homeless students. So besides being a humanitarian thing to do. So
oh,
Are you in communication with the McKinney-Vento people?
No, we dealt with Justin is the person we
Oh.
dealt with.
Yeah.
And it was kind of a, testing situation to see where he was going to come down. And he was very excited about it,
Good.
about the idea of it.
Any other updates? We might end up being able to give you back some time, Pastor Michael.
Yeah, I just wanted to say that Lindsay Gagnon from VOA in Sultan is doing an incredible job with the coordinated entry system, as well as the after hours, or whatever it's called, the showers that they're doing out there,
Yes.
as well as in Monroe Y. And then the other thing that she's doing so well is the cold weather shelter at the fairgrounds. That's been
Yes.
so good. Yep, they're doing a good job.
Well, I'm going to ask, actually, hey, Dennis Smith, are you there?
That's true.
Since we have you, is Granite Falls going to apply for either the DMA grant or the MHPP or suicide prevention grant?
I've made a note here to talk with you about that because I think
Perfect.
we've been very fortunate to have about 4 grants that have been awarded to us. And I think the personnel to follow through with those may be the only issue, but I think that sounds like a great opportunity. We have been, you want me to share my information now for?
Please, yes, please.
So we did get those grants, which has enabled us to pursue some projects we've been long wanting to do in the district, and some that's been kind of forced upon us because our food bank, we had to reestablish that. We hired our first employee as the food bank manager. He's doing great things with that. We are also moving ahead. We've signed a long-term lease with the school district for a space on campus, which will house our coalition offices and food bank services through that, which can contribute to our backpack program. We got an early childhood grant that we're now doing a community survey to identify areas that we want to work on with that. So a lot of great things happening there. And it's quite amazing that in a time like this pandemic, that all these good things happen in terms of funding, but we kind of have to take advantage of it, I think, when we can. It's just finding the personnel to follow through with that. So,
Yep.
So can I give you a call later? And
Definitely. Yeah.
Sounds very
Shoot
interesting.
me an email and we'll Zoom together.
Yeah, and I'm very interested in what Lindsay has been suggesting to you too. Sounds great.
Yep.
Thank you.
Any other updates? I think you guys have your time back. Like I said, next month, I'll have some more detail and the reminder will go out earlier, but we'll really need to spend some time just planning through what's coming up for us in our next 12 months or so. So it's exciting to have a next 12 months in the world of grant funding. And I don't think we're going anywhere. Thank you, guys.
Bye, everyone.
Thanks, everyone.
Bye all. Thanks for including me.
Always.